In today's episode, we are going to look into the non-clinical career options that are available in the healthcare industry. So you have two options: one as a medical coder, and the other one is the administrative side of in the healthcare industry. So, what is medical coding? What am I going to do becoming a medical coder? So, as a medical coder, you will be reviewing the accuracy of the records that are assigned to a patient during his or her treatment, especially the accuracy of the records and the codes that are being assigned for the treatment. And you will be assigning those codes based on the international disease classification and the current procedural terminologies. That is International Classification of Disease and Current Procedural Terminologies, which they call it as ICD and CPT. As a medical coder, you will also be responsible for keeping up to the changes in the requirements. I mean, the industry changes, the regulatory requirements, and keeping up to the standards. And you will also be communicating with the healthcare providers to get clarification about their treatment. And if you find any mismatch, you are the one who is going to raise that red flag. So, as a medical coder, you have opportunities both inside a hospital as well as in the health insurance industry. That is, the insurance company will also be hiring you. Unlike the clinical profession in the healthcare industry, this does not require a huge years to be invested in your studies. After your 12th grade or after your high school diploma, you need to invest 2 years for your associate's degree. That's the AA degree for medical billing and coding. And once you complete your AA degree, you will be passing a certification for the ICD and the CPD, that is the International Classification of Diseases and the Current Procedural Terminologies. So while you're undergoing your AA degree, you can also earn your CCA and the CPC certification, that is the Certified Coding Associate or the Certified Coding Professional certificates. So once you get this completed, you can move into a healthcare settings, that is to a insurance company or a hospital, where you will be completing 2 years of apprentice or 80 hours of coding preparation program plus 1 year of apprenticeship to become a full-fledged medical coder. In the US, this is the procedure in the US. And if you're in India, you can, graduates with B Farm and even some of the graduates with BSc in chemistry or biochemistry can also become a medical coder if you're in India. That's the 3 years course. And I have actually heard about some online institutes in India which is offering the CPC and the CCA certification along with the ICD and the CPT learning. I'm not sure who is offering in India, but I heard that it's actually happening over there. Uh, but make sure that you go and join a reputed institute. And by the way, if you know any such institute, please comment below so that it will be helpful for others who's watching this video in future. They can refer to the institute where you think it's reputable and they have a good curriculum covering all the CCD and CPA courses. Um, and again, in the US, as a medical coder, your average starting salary would be around $50,000 per annum, and in India, your average starting salary would be around rupees 3 lakhs per annum. Again, this is just a ballpark figure. And the other option you have in the healthcare industry in the non-clinical field is pretty much in the hospital administration. You can get into the hospital administration right from the front office to the back office. In the front office, you can be a front office coordinator where you will be working with scheduling the appointments with the patients, contacting the insurance companies for processing the payments. And in fact, you can also become a HR professional in the back office. And there are multiple other opportunities for non-clinical, even in the legal services for clinical or hospital or insurance company setup. And all these would require some kind of expertise in your field. So you will be completing, say, if you're a HR, then you would need an MBA in HR. As if you want to start as a front office professional or an administrative professional, a bachelor's degree would help you, get into these fields, especially a bachelor's degree in science. Maybe you might even have a pre-med. You want to try some years here in the hospital setup before you move on to your graduate course in medicine. that's a good opportunity for you to explore into this non-clinical side. And of course, the salary depends on the role that you play. For a front office executive, it could start in the US with like, say, around $40,000 per annum. That translate in for India in a urban environment for about rupees 4 lakhs per annum. These are the starting ranges. But of course, if you're a HR or a legal service professional with a master's degree or a legal graduate degree, course, your salary ranges would go up. That's anywhere in the starting range of like $70,000 and above. So that's about the non-clinical careers that are available in the healthcare industry. And if you like this video, give us a thumbs up, subscribe to Campus Compass, your career navigator. I'm Keerthi Jeyaraj. Thank you.